Hello, and welcome to the Well Beyond Breast Cancer podcast. I'm Shira, a breast cancer previvor and your host. This show shines a much-needed light on what comes after diagnosis, the side effects, the recovery, and the real-life journey of feeling like yourself again. Each episode brings real stories and expert guidance from oncology and rehabilitation professionals so you can better understand and manage side effects and truly live well beyond breast cancer. Thanks for being here. Well, hello, everyone. Today we are joined by Alexandra Hill. She's a physical therapist and certified lymphedema therapist who's a dual board certified specialist in pelvic and women's health and oncology physical therapy. Alexandra is also the owner of Pelvic PT and a national educator and speaker who is deeply committed to providing inclusive rehab care. It is such a pleasure to have you, Alex. Thank you so much for joining us.
Thank you so much for having me on. I've been looking forward to this.
Yeah, I have too, especially since we had our little intro and I was like, this lady's poppy. I like her. I like this energy. I'm here for it. I was like, we're going to just have a bouncy time.
It's a whole vibe.
It's a whole vibe. Exactly. Hopefully people that are listening and watching are ready to just feel the vibe throughout the conversation. So without wasting any time, I want to get right into asking my first question. And I think that this is going to be a really interesting conversation for people that are going through breast cancer or maybe have friends that are going through breast cancer. My first question for you is intimacy and sexual health are rarely talked about in breast cancer recovery. Why has this been overlooked and why is it so important to bring it into the conversation?
I love it. Coming in hot with the most infuriating question, frankly, for a lot of people. You know, so many people are just suffering in silence, and especially with breast cancer survivors, looking at different studies, but upwards of 70% of breast cancer survivors have some type of sexual dysfunction. And like you said, nobody's really talking about it. So that comes from a couple different aspects. So one, on the patient side, it can be really uncomfortable and embarrassing to bring that up. And I've noticed, I've experienced a lot with some patients who they feel almost kind of a guilt asking about it because they say, oh, well, I beat cancer. Sex should be the last of my concerns, or intimacy should be the last of my concerns, which, in my opinion, yeah, you beat cancer. You should be enjoying all that life has to offer, including your intimacy,
Yes.
right? And enjoying your body and your partner, versus this guilt about not enjoying that. And so some of that does come from the patient side of just not feeling comfortable asking about it. But the onus is really on the providers. The providers should be asking these questions. We ask about everything else. Why not sex? And there actually are studies that have looked at oncology providers in particular, and the rates of them asking their patients about sexual health concerns or symptoms is abysmally low. It is so low. And some of the reasons that are cited, and even talking with oncology providers and other healthcare providers, is they feel uncomfortable asking, which is just crazy, right? You're trained at all of these things. How can you feel uncomfortable asking? Do you have concerns about intimacy? It's that easy to ask. But a lot of people on the provider side don't feel comfortable asking it. And even if they do feel comfortable asking it, one, they don't know when to ask it, right? Timeline wise, is it before they even start treatment?
Right.
Is it after they've already started treatment? Is it at the 6-month survivor appointment? It's a timing thing of when is it appropriate to ask. Hint, it's all the time, ask. And then also a lot of people don't ask because they don't know then who to refer to. They don't want to kind of open up that bag of worms of, okay, I know that you have sexual health concerns and I know that you need help, but I don't know who to refer you to or who to send to help you. And so, it's a lot of different aspects to it, on why this isn't getting talked about and why this isn't getting addressed more.
But I think to your answer, And this week has been very heavy for me in going to all these panels about breast cancer awareness and perimenopause and menopause and all of this. It really comes down to you, the survivor, thriver that's going through it, previvor, whatever it may be, that you need to advocate for yourself. If it is a concern for you and your provider is not talking to you about it, doesn't mean it doesn't exist. It clearly exists,
Yes.
just as you said, and it needs to be spoken about. So it's up to you, if it's not spoken about, to really bring it, which is frustrating,
Mhm.
but don't let it don't let yourself believe that you're lost and there's no point anymore.
Yes, exactly. And I think for a lot of people, it's like, how do I bring it up in the appointment? Especially, especially in the US, our appointments are so short. And it's making sure, on the provider side that they're hitting all of those major concerns that could escalate to something more, right? Is there recurrence? Are you responding well to treatment? That kind of thing. And so it can be hard to like, okay, when do I squeeze this into my conversation? So I tell a lot of people like come with somebody with you so they can help kind of advocate with you and also listen and be part of it, or send them a message. Like I send my providers messages all the time on my chart like, hey, I have this upcoming appointment, but like this is a concern, so it's already documented, right?
Mhm.
And sometimes that reaching out ahead of time is really helpful. And a lot of times, with most cancer centers, they have like that distress thermometer
Mhm.
that asks about different concerns. Sex is on there. And so, make sure that that's not something that's just getting filled out and then getting filed away. Say, hey, with that, thermometer handout that I filled out, one of the things on there was sexual health. Is that something that we can talk about today? So it's just finding, like you said, that voice to advocate for yourself, but finding different ways that you can kind of get that courage or get that time to step into it.
100%. I know from personal experience, has nothing to do with breast cancer. That has everything to do with my pregnancy right now. My husband comes to our appointments with a
Mm.
list of questions. He asks more questions than I do, but he asks bless his heart, but he comes in hot, and without those questions, sometimes I wouldn't know the answers, and sometimes I don't think of it, and sometimes he's
Mhm.
even pushing a topic that maybe, the doctor's tabled for a little bit but wants to come back. So if you do have that partner, or if you do have a friend or advocate or whomever, that bringing
Mhm.
them to an appointment is a wonderful idea. I think that's a really great
Yes.
one. So, my next question, many people don't realize how much pelvic and sexual health is affected by cancer treatment. Can you explain what's happening in the body and why it matters?
Yes. So I think we need to kind of zoom out a lot here and think, when people first think about sex and intimacy, they think immediately of the genital area, the pelvic
Hmm.
area. But when we really zoom out, the biggest sex organ is our brain.
Mm.
So think about that desire, that arousal. If you are in fight or flight mode, if you're in survival mode, sex is not on the table for your brain to even be thinking about. And so when the brain is also working on processing everything that you're going through, it's also not only going to be having a hard time with that libido and arousal, but also that communication with your pelvic floor and feeling comfortable with your body or feeling comfortable with penetration. So that's the very first thing is just the mental load of getting the diagnosis and dealing with the treatment and all the appointments and the financial impact of it. And taking time off work and also being a caregiver or a parent or a sister, family member. There's so many other things that your brain is also trying to work through. And so that's always like the number one thing is if people are having some type of sexual dysfunction, we have to make sure that we're taking care of the brain and our mental health. So that's the very first part of it. But then when we look at the actual treatment, and let's look specifically with breast cancer. So hormone therapy is a very common treatment that's utilized, but what does that do? Is it sends you straight into menopause, HE double hockey sticks, right? And it's not like this progressive thing that we would go through kind of naturally, but I mean, it can be fairly quick with these symptoms that people have. And with those menopausal symptoms from the hormone therapy, that can be vaginal dryness, we have that decreased estrogen, and so that can also cause decreased pliability with the tissues of the vaginal canal. So you think if those tissues are not pliable, so they're not able to move very well, they're not as stretchy, and they're dry, they're irritable, you can imagine how that would be uncomfortable to have sex or
100%.
anything penetrative. And so that hormone therapy is the primary driver for a lot of sexual dysfunction among breast cancer survivors. We also need to think about body image. And especially for folks who've had a breast cancer surgery or radiation therapy, that changes your body. And so you're having to reconcile what your body looks like, how it feels, how it responds. Maybe you don't have sensation in that area anymore because of nerve damage from the surgery or radiation. So then it's also having to relearn what feels good and what you feel comfortable with, and really communicating with yourself and your partner about those different types of things. And then one thing that often gets kind of left out, but I always like to bring it up, is chemotherapy. So with chemotherapy, that can cause neuropathy. So chemotherapy induced peripheral neuropathy, or CIPN, or SIPN for other people who like to call it that. But that causes a numbness, tingling, sometimes even a lot of pain, and altered sensations at your hands and at your feet. Think about how much you use your hands with sexual play, right? If you can't weight bear, put weight through your hands, say in different positions, or support yourself, that can also impact how you interact with your partner, or even with yourself with sexual play as well. If you have that neuropathy in your hands too. So it's, a lot of different things, both systemic with the brain, and then also locally, because, that hormone therapy that can contribute to some of that sexual dysfunction. And it's really, trying to tease out what are the biggest factors in each person's case, and how do we address those comprehensively?
It's funny. I realized that that was a big picture question because my next question was a little bit more detailed. You beat me to it. Ha. Ha. So, just so people understand my next question, pain with intimacy is something many survivors experience but don't talk about. What causes it? And more importantly, what can actually be done to treat it? So,
Yes.
I guess that it, like, you answered the first part, but then there's
Mhm.
that second part of like, okay, so I have the neuropathy, I have the
How do we
dryness,
do?
I have what do I do now?
Yeah, absolutely. So again, if we kind of look big picture to smaller picture. So first is mental health therapy for sure. Oftentimes it can be helpful even working with a sex therapist. So that's a mental health therapist who has additional training specifically with sexuality. And if you can find someone who is a sex therapist and also works with cancer survivors, that would be like optimal. It is, and I answer questions all the time. So it's a hands-off therapy with sex therapy. It's a talk therapy. So if, people always get a little worried about, like, what does that actually mean with sex therapy? But it's again walking through your new body, and communication with your partner, and acceptance, and learning about sexuality. So I always recommend a mental health therapist, especially a sex therapist, one that's ASECT certified. So AASECT is the organization. You can go on there and find a provider. And then now, if you look, kind of get into the pelvic area in particular. So again, I mentioned the hormone therapy. The chemotherapy can also induce menopause as well. And so what we need to do is address, one, the vaginal dryness. And so we can do that with recommending different moisturizers. There is research that supports the use on an individual basis of using vaginal estrogen. So this is still a hot topic with a lot of providers and with a lot of breast cancer survivors, but there is growing research that supports the use of vaginal estrogen that can be a total game changer if people have severe dryness, severe pain, bladder infections because of those tissue changes. Again, a lot of people don't want to use anything hormone related, and that's a okay. There are non hormonal moisturizer options that are available. Making recommendations on lubricant. Lube is the way to go. We want to keep it slick. So even if you feel like you are kind of quote wet, still use the lube. It's going to be more helpful than you know. Because again, those nerves have changed, that
Mhm.
tissue response has changed because of that treatment. And then the other really big thing that we recommend is something called dilators. So these are, think of them like vaginal trainers. So if somebody has pain with that initial penetration, for those of you watching, so if this is the vaginal opening, if it doesn't accommodate very well or open up very well to allow for that penetration, that's what can be really painful. And so these dilators help to essentially improve that flexibility and that tolerance of those tissues so that the penetration isn't as uncomfortable. And so I've worked with
Interesting.
people that are able to work their way up with these graduated sizes to be able to achieve pain free penetration and
Hmm.
not just with sex, but also think pelvic exams in general, right? On the
Right.
medical side. If you're having pain with sex, you might be having pain with that speculum going in. And so I always encourage people, even if you're not sexually active, the dilators can still be really helpful if you're having pain with those pelvic exams. So the dilators are really, really helpful. There's a lot of research to support the use of them. And then, of course, pelvic floor retraining. So again, we talk about the brain being the biggest sex organ. The brain is part of that nervous system and that fight or flight. So if you think about your body when you're in fight or flight mode, it's typically tense, right? Like think about your jaw getting tense, your shoulders tense, causing a
Sure.
headache. Your pelvic floor can also get tense and overactive and tight. And so if it's constantly in that overactive position, that makes it harder for those muscles to be flexible. And so it can help with retraining those muscles to get them to relax better, get more coordinated, and not be so guarded when you're getting into a sexual or an intimate situation. So they're able to relax and you're able to actually enjoy the sexual activity.
I never knew about the dilator. That's so interesting. And
Yes.
also to think about it with pelvic exams because those exams are not fun.
You're right. Exactly. Exactly.
They're not fun for when it like feels okay. So I can only
Exactly.
imagine how painful it is for someone who's struggling with that.
Yes.
That's real. So
Yeah, and especially, the speculums, they it goes from this, with your fingers together and like open up like really quick. So if your tissues can't accommodate that quickly and your provider's maybe not going a little slow and steady with it, that's of course that's going to be painful. So some of that is, maybe working with a pelvic health therapist with the dilators, the retraining, but also some of that also comes with the communication and talking with your provider of, hey, like these pelvic exams are uncomfortable. Can you like walk me through as you're doing it, or maybe even use like a pediatric speculum, which is a lot smaller than the adult one. I have some people that do
hmm,
that as well. You're never powerless. I always just like that's the biggest thing I want people to take away.
100% from the moment we started talking, you're never powerless. 100%. So treatments like hormone therapy can be create long-term changes. How do these impact libido, arousal, and comfort, and what support options exist?
Yeah, so I think I touched on those a little bit because I like to ramble and go through a lot of different things.
Love a ramble. Yes.
But especially, we think about the sexual cycle and in particular the libido, the arousal, the desire.
Right.
What we see typically, especially with those living with or beyond cancer, is that everything is delayed. So it takes longer to get aroused. It takes longer, like,
Mm,
that feeling where you're like waiting, like you're almost there, you're almost there, you're almost there, like you just never quite get there. Like that tends to get prolonged. The orgasm is typically not as intense either. And you also need more stimulation to get to arousal, to get to desire, to get to that point where physiologically you're getting to that point where you can maybe reach climax. And so a lot of that can be really, really frustrating for people because they had maybe no problems beforehand, maybe multiple orgasms, and now they can like maybe reach one. And
right.
so that's where working with the sex therapist can be really helpful, but also working on the pelvic floor muscles. So working on, quick contractions can help with getting more blood flow into the area with orgasm, the pelvic floor contractions is part of orgasm also, so that can be helpful. The other thing I usually recommend for that arousal is using what we call in our documentation, especially with insurance, vibration therapy, or for those of you listening, a vibrator. So there's a lot of different options that are out there, and this can just be used externally. This doesn't even have to be used internally to have good benefits Because as we bring more blood flow to the vulvar area and to the clitoris, especially, that's what really helps with getting more blood flow, helping with the moisture, helping with that, those good feelings of desire and starting to kind of kickstart things. Um, I usually recommend a lower vibration. One of my favorite products out on the market right now is something called the kiwi, like the fruit,
Hmm.
but it's from the pelvic people, but it has more of a rumble motor versus like a vibration motor. So the sensation is a lot less kind of jarring for a lot of people. And it's really good for just starting to bring some more blood flow to the area. So that's one thing that I'll usually recommend. And also recognizing how you respond. So for a lot of people, especially women, we are not just like, "Oh, hey, like, I'm feeling you. Like, let's go to the bedroom." Like, we need, like, an all-day foreplay. Like, we need a slow burn, right? Like, we need a you took the care of the dishes this morning? Amazing. Oh, you got the kids to bed last night? Amazing. Like, all of these little things help with our connection and our desire and our arousal to our partner. And so finding little ways or communicating that with your partner, sending sexy little texts throughout the day just to kind of build that anticipation a little bit can be really helpful as well. If you're solo or if you're not comfortable doing that, then even sometimes just reading erotic readings, there's a lot of like the smut reading available now that's like really popular. But sometimes just reading that can start to get things going in terms of thinking about it again versus this like cancer, not cancer dichotomy. So it's just finding ways to enjoy your body and enjoying those sensations more.
Very, very true and very helpful. A lot of people are told these side effects are just something they have to live with. This kind of goes back to what we were saying before. How do you challenge that narrative in your work?
So, couple prong approach, I would say. So, one, education online. So, I started Oncopelvic PT in 2020 because of one, there was just so much badness in the world at that time. But there's also so much of that misinformation and disinformation, including sexual health among cancer survivors. And so for me, part of that is coming to the masses through social media, through blog posts, through newsletters on these myths that you just have to deal with it. Why? Why? Or to not even be given options of what treatments could potentially help. Like to not be given that is just insane to me. And so that's one way for me is just educating people online and making those resources free and available for people, but also being somebody that they can trust because there are so many people out there now that are just out to make a buck. They're, these wellness influencers and all these people that are like, do this thing or take this oil and then you're good to go. That's likely not the case. And so making sure they have trusted resources available on the individual level, doing a lot of education, networking, going to different groups. I went to a meetup earlier this week with different practitioners who were chiropractors and physical therapists, occupational, functional nutrition. And so many people were like, wait, you can work with cancer survivors? Like, you can work on sex with cancer survivors? That, like, so many people don't know about it. So, if there are providers that are listening, the more that you can spread the word, like get on your soapbox anytime you can, whether it's at a tumor board meeting or, having one-on-one appointments and talking with the providers in your area. Again, back to, your first question of why is this an issue? Nobody's talking about it. So if we can bring this forward to providers and hey, if one of your issues is you don't have a problem with asking, but you don't know who to send them to, hi, I'm your pelvic PT down the hallway. Send them over to me. I can screen them. I can get them started on things. And I know sex therapists or other providers who can also help along with this journey. And then just really, like you said, like making sure people advocate for themselves and know where they can go to, and who they can turn to and who can actually help them.
So I think it's educating and advocating. Those are the two
Hmm.
things. My takeaway is,
Yes.
you want your providers to advocate for you, you want to advocate for yourself, and
Hmm.
you want both. An ideal world, you and your provider know what's going on and you can kind of, find the path that way. But in an ideal world, the provider has their act together and knows what's going on.
Yes.
So
And that's
that's
not to say
that.
it's everybody, right? Like
Right.
I've been at some amazing institutions where, I started out at Duke and they actually had a sexual survivorship clinic for breast cancer survivors. That was integrated into their program. So there's definitely some amazing programs that are out there, but in general,
It's not enough.
across the world,
It's
it's not
yeah,
exact. It's not
it's
enough.
not enough. I mean, it's the same thing with physical therapy before and after breast cancer
Yep.
surgeries. You know,
Yeah.
like some people do it, some people do prehab, some people do rehab, but some people don't even know it exists and they
Yeah.
have to go through life.
Exactly.
It's the same thing.
Yeah.
So, yay for the people that are talking about it and gold
But
star
get
for
more
you.
people talking about it.
Yes, exactly. And that's why we're here. That's why we're here. And I guess this question kind of goes into it, but from your opinion, why do you think breast cancer rehabilitation still isn't treated as a standard essential part of care? And what needs to change to normalize it?
Okay. So I'll start with the good. What's really good is we have a lot of research that shows the benefits of prehab and rehab for breast cancer survivorship. There's, the landmark study, gosh, at this point, 12, 14 years ago, on the prospective surveillance model, or PSM. And essentially what that means is from the point of diagnosis, you are assessed by a rehab provider, you get baseline measurements, you follow up with them periodically during treatment and after with the whole goal of mitigating symptoms and improving function. So that's the good. We have the research that shows that, and also more research on pelvic health therapy or, pelvic health PT or OT, working with sexual dysfunction. So here's the bad part is what is a main driver of healthcare in the US? Insurance and reimbursement and payment. So one common issue with a lot of especially hospital systems is with prehab is the billing for it. So, if somebody comes in and they don't necessarily have impairments, how do you bill for it? And so some places just then don't do it. And then they see the patient afterwards, whereas then sometimes you don't know what their baseline was, right? Reimbursement rates for PT, I can speak to PT reimbursement rates in general have fallen year after year after year. It's harder to get the services that are needed and get quality services that are needed. And what we are getting paid for by insurance companies keeps dropping. So, a lot of people have gone to PT and they're like, oh, I was double booked and triple booked to these other patients and I didn't get the care I needed. Well, it's not the therapist's fault. It's
Right.
insurance and a system issue that then trickles down to the individual patient. I think one of the other issues is we're compared to other specialties, orthopedics, sports, even neurology, geriatrics, we're a relatively newer specialty within physical therapy. So even, the women's health, pelvic and women's health specialty was at this point, I think maybe 45, 46 years old since it was kind of started. Oncology, we just got our first board certifications within the last 10 years.
Mm,
And you compare that to decades of other specialties. And so when you then look at the number of oncology PTs who are available to then work with,
mm,
over 18 million cancer survivors who are living longer with side effects from treatment, there's just not enough of us.
mm,
And so, again, we look at this from a system level of payment and access, right? I've had people that have driven almost 2 hours to come to see me because there is literally no one
no
else
one.
near them that does pelvic oncology. That should not happen. Right. And so, this is why I and a lot of other places, we offer telehealth therapy to reach and kind of close those gaps, especially for people who are in rural areas or just there isn't anyone near them. But that access to care, access to somebody near them who's available, those are some of the really big barriers. I don't know specific numbers, but I know for lymphedema therapists, right? It said that there's one certified lymphedema therapist per 1,000 people with lymphedema in the US. And that's an old number. That's an older number. I think if we looked at that now, I think because more people are getting diagnosed with lymphedema, right? I don't think that the number of lymphedema therapists has increased at
Gone
the
up.
rate of people
Yeah.
getting diagnosed. Issues on why this is still a gap. And then like we're just talking about, a lot of providers don't even know that we exist or what we do as
Exist.
oncology PTs either. And then once they know, they're like, "Oh my god, like you can help my patients with this and this and this and this and this. And that makes my surgical or radiation oncology outcomes better. Awesome. Like let me give you the
Yeah.
referrals."
Yeah.
But again, they just don't know everything that we do.
Interesting. Wow. Oh man, everybody needs to talk a little bit more to one another.
Yes, talk it
And
up.
beyond the physical side, how do you see intimacy and body confidence evolve after breast cancer? And how can rehab support that process?
So I think I touched on some of that already. A lot of it is, not just how you look after these procedures, but it's how you feel also. Pain and cancer related fatigue are the top two complaints across all cancers. Upwards of 90% of people deal with cancer related fatigue and pain at some point. And so you think about like dealing with that and body image also, like you already don't feel good. You feel like crap and you don't like how you look now, or it's just different now. That just compounds on itself. So with physical therapy, we can certainly address a lot of those physical things. We can address cancer related fatigue. We can address the pain. Maybe you like to have your arms up overhead with sexual activity, but you can't because you have cording or you have tightness
Uh,
after
uh,
radiation. So, girl, we can work on getting your arms up as high as you want. We can work on your strength to get in the positions that you want. If you want to be on all fours, awesome. Let's work on your shoulder control, your postural control, scar tissue, sensitization, or improving the sensation of the tissues in that upper trunk area. Um, like I said, addressing the neuropathy and then also addressing the pelvic floor conditions as well. But if we're comprehensive with everything that we're addressing, that tends to help more with that body image because you feel better. If you feel better, it can make it a little bit, I wouldn't necessarily say easier, but a little bit more cohesive with then also working on like the body image acceptance as well. A lot of times it's really helpful to work both with PT and a mental health therapist as we work on
mhm,
things, especially if the mental health therapist has specific strategies on mind body connection or down training as you are looking at your body in the mirror or as you are touching your skin. A lot of people don't want to touch the scar or the skin. It feels foreign, it's painful. It's not them. And so we can incorporate some of the strategies that they're using in therapy and incorporate that with then our desensitization techniques or with our therapeutic techniques as well.
when you have a wonderful guest like yourself that it makes this more like a conversation, the questions kind of all bleed into one another. So, because I like to ramble too, and I love just a good just conversation, I'm still going to ask the questions. If someone listening is struggling with intimacy or pelvic discomfort right now, what are the first 2 to 3 steps they can take to start improving things?
One, talk to your provider. Just to screen anything else that could be going on. That would be number one. Uh, and that can be anyone on your oncology team. All 50 states have and I know there's PTs and OTs. I talk from a PT lens, but in all 50 states, PTs have direct access, meaning you do not need a referral to start seeing a PT. Depending on the state practice, you might then need to get a referral after 30 days or something. But if it's taking a while to get in with your oncologist or your next oncology appointment's 4 months away, but you can get in with a pelvic PT next week or in 2 weeks, they can also get started with you as well. So the first thing is just recognizing that there's something that you want to get worked on and then identifying the person to help you start making those steps. Um, I think the second thing would be communication. If you have a partner, communication with your partner, because this can be a very, very isolating thing to be going through. And so if you're able to communicate either verbally, through a text message, through a note, through a drawing, like something to help communicate what you're feeling, what you're going through with your partner, that can be really helpful so that you have someone else who can collaborate with you and help work through this as a team versus like you're just going through this alone. And then number three, especially for breast cancer survivors, I would say just because of the vast prevalence of vaginal dryness, if you have the dryness, starting with a moisturizer can be really, really helpful.
As you mentioned earlier, and we talked about that. For someone who feels disconnected from their body or afraid that intimacy won't feel the same again, what do you want them to know?
I want you to know that it's okay. Our bodies change. My body, I'm turning 38 this year, is not the same as when I was 28. Our bodies change over time, and let alone through the trauma of going through cancer and cancer treatment and now the side effects from it. And it's okay to one, not be okay in the moment, but it's okay that things change also. And I find that the patients I work with who come at it with more flexibility of, you know, this is painful, but now that means I get to tell my partner that I get extra time with foreplay because that helps me. Awesome. Or finding different ways to connect with their body. So there's something called sensate touching, Sensate, that you typically would do with a partner, but it's essentially mindful touching of your body and of each other's bodies to just re-explore it. We're finding out what's new with it, what feels good now versus what doesn't feel good compared to before treatment, for example. Body mapping is really helpful. So like make draw a little gingerbread person and like as you are exploring your body by yourself or with your partner, like, "Oh, my ear, I like that. That's a check. And at my breast right now, I don't feel comfortable with you coming at my breast. Those are big X's for right now." So recognizing what feels good and what doesn't feel good can also help to kind of guide that body image, that body awareness, and how you feel within your body. And it can also be a good conversation starter, both with your partner and with your provider as well. If you're able to give that information, that automatically helps me kind of tailor exactly what I'm going to do from the very first visit.
Such good advice. I like the body mapping idea. I'm a big visual person.
Yes.
I think if I can see it, then I can believe it. The last question I have for you, and this is something that we ask all of our guests. What does living well beyond breast cancer mean to you?
Living well beyond breast cancer means living your joys without bounds, however that is. And sometimes that means finding the small joys. I'm not dealing with cancer myself, but I'm dealing with a lot of chronic health issues that have been getting worse lately. And it's been hard not being able to do the things that I love. I love to go hiking and I can't go hiking right now because of these health issues. And so I'm finding joys in just being on my deck and being mindful and listening to the birds and feeling the breeze. So, any way that you can find those joys and bring those up with just everyday activities, that I think is what it means is finding that joy without bounds.
That. I also love that you live in a place that you can be on a deck and listen to birds because I live in New York City and I'm hearing them like plow my street every morning lately. That just sounds so relaxing. Way to shove it in our faces, Alex.
I mean, but
Jeez.
that's what, right? Just headphones and just get some noise canceling headphones.
Yeah.
Just get on some
Yeah.
nice birds chirping, some forest
I love that.
noise. I'll
I
send
love
I'll
that.
send you
Some
a
white
picture of my
noise.
backyard. You get
Yeah, send me the
some
picture. I'll put it
greenery.
as my screensaver and just namaste it out. Alex, thank you so much for joining us today. I really appreciate it. And I know that people are going to enjoy this conversation and hopefully share it with people that they think would benefit from it. Because I think anyone, honestly, that's been through a change in their life could definitely listen to this. Previvors,
Mhm,
survivors, thrivers, just someone who's going through a change in their life
mhm.
as they get older. Intimacy is a challenge and it's hard to navigate. And this is an important conversation. So there's definitely tidbits in here for everyone to learn from and take away from. And we appreciate you spending the time to talk to us about it.
Yeah, I appreciate the platform. Anytime I can talk about sex, I'm on. So thank you very
Same.
much.
Bye, Alex. Thank you so much.
Bye. Thank you.
Thank you for joining us on the Well Beyond Breast Cancer podcast. If today's conversation moved you, please subscribe and share it with someone who may find it useful. We'll be back next month. Until then, keep advocating for the care you need. Your quality of life matters.